Thank you, Jody. Good evening, everybody. Can you all hear me? The microphone? Okay. As Jody said, I'm with the SBA Cleveland District Office. My day job there is to run the Capital Access Division at the SBA. We're the single largest provider of financial services to the small business community in the United States. We're having a great year in Cleveland. We're leading the nation in terms of lending per capita for small businesses in our district territory, which is the northern 28 counties of Ohio, including Summit here. So we're having a real good year. The banks are very active using the SBA program with our loan guarantee that we provide to the banks. And I think a lot of small businesses who need access to capital are getting it this fiscal year. We also have another couple programs we offer for small businesses. We have our management and technical assistance programs, our counseling services, and those are offered through two different organizations. We have our Service Corps Retired Executives and our Small Business Development Center network that provide those counseling services at no charge to people thinking of starting businesses, or if you're in business and you want to talk over a few things with an experienced counselor, feel free to contact our Akron Small Business Development Center or our Akron SCORE chapter. They're located on West Market Street, right outside of downtown Akron, and they're in the phone book. The third program we have for small businesses is our government contracting program. The feds buy everything. So a lot of small businesses are selling things that feds are looking to buy. If you're looking to expand your sales base and you've never considered selling to the federal government, depending upon what you do and what you sell, it might be an avenue for you to explore. We do a monthly seminar at our Cleveland office on the government contracting program, and there's more about that program on our website, sba.gov. So if it's something that interests you, you may be able to stop down to one of those in-depth seminars they do. I believe it's the fourth Friday or fourth Thursday of every month in our Cleveland District office. We're located right in downtown Cleveland in the Playhouse Square area at 14th and Euclid in the U.S. Bank building. One of the clauses on my job description is the other related duties. So even though I'm the head of the Capital Access Program, I've been the office designee to deliver the Affordable Care Act seminars throughout our district. I've probably done about 15 of them over the last 12 to 18 months, and I've gotten a variety of crowds and some tough questioners and others who were supportive of the program. And generally speaking, though, I think most people found the information I'm going to deliver tonight to be of interest and helpful for their businesses. So I'm hoping you get a like experience this evening. I think the best way to handle this, it's kind of a difficult talk to deliver, and I'll do my best in delivering it, but rather than waiting till the end on questions, there's so many different things I'm going to talk about, it probably would be wise to handle questions right as they occur. So if you have a question on material I'm covering, just raise your hand. When I'm finished with that particular slide, I'll ask you to state your question, and we'll try and get it handled right then and there. Is everybody okay with that format? Okay. All right, let's get started here. The Affordable Care Act, it's been around now for a few years. What the health care law means for small businesses. And again, this talk this evening is geared toward business owners, not individuals looking to get health care coverage, business owners or sole proprietors, one owner business people. The materials I'm going to speak about this evening are provided for informational purposes only and are not intended as legal or tax advice. You should consult your legal or tax professional to discuss how the matters relate to your individual business circumstances. For years now, small businesses have been stating that their number one problem, number one concern in running their business is access to affordable health care. Currently, small businesses pay an average of about 18% more than large businesses for health insurance. The Affordable Care Act will help small businesses by lowering premium cost growth, not cutting your expenses, but lowering the rate of increase, and increasing access to quality, affordable health insurance. Based upon some of the statistics I've seen so far on the ACA, I think, in fact, that the premium cost growth curve is reduced significantly this year as compared to what it's been for the past few years before the ACA was introduced. Before the Affordable Care Act, small employers faced many obstacles to covering workers. You had too few choices: higher premiums and unpredictable rate increases, higher rates for groups with women, older workers, and those with chronic health concerns or high-cost illnesses in most states. Also, the waiting periods or no coverage for individuals with pre-existing conditions. Under the ACA, the insurance companies face limits on administrative spending. Most insurers must now spend at least 80% of the consumer's premium dollars on actual medical care. They call that the 80-20 rule. 80% of every premium collected must be spent on health care. In the past, it was closer to 50%. The insurance companies were using those premium dollars for other purposes other than health care. Now they must spend at least 80% of every premium dollar collected on actual health care. Also, insurance companies must disclose and justify proposed rate hikes of 10% or more, which the states or the federal government may review. Insurance companies can't charge higher rates or deny coverage because of a chronic or a pre-existing condition. They cannot charge higher rates for women and face limits on charging additional premiums for older employees. The insurance companies must pool risks across small groups, creating larger pools just like large businesses. There's no restriction now. They must not have an annual dollar limit on coverage. And each insurance company must offer plans that provide a core package of essential health benefits equal to typical employer plans in the state. That's a policy with essential health benefits that's going to give somebody the ability to go get a physical exam or go to the dentist or things like that, that sometimes those low dollar premium plans they had in the past, all that was catastrophic coverage. It didn't provide any type of coverage for everyday type of health care, like a physical exam or dentistry or the like. The Affordable Care Act reduces premium cost growth and increases access to affordable care. From 2010 through 2013, up to 35% of the premium contributions, 25% for tax-exempt employers for their employees' health insurance. For 14 and beyond, eligible small businesses can get a tax credit worth up to 50%, 35% for tax exempts, for health coverage offered to employees through the shop. That's the only way you can get access to the tax credit if you qualify, if you buy your insurance through the shop. Yes, sir.
Is that for sole proprietors also?
Sole proprietors aren't eligible for the shop. I'll cover that later on. There are now better options through the new health insurance marketplaces. As of January 1 of this year, the self-employed and small businesses around the country have access to a range of affordable health care options through either the individual marketplace or the shop. We're starting to see a difference for Americans as a result of the Affordable Care Act. 6.6 million young adults now have coverage through their parents' plans till they're 26 years old. 17 million children cannot be denied coverage due to a pre-existing condition. 15 million Americans can no longer be dropped by their insurance companies, or they can't, the ACA, in the past, the insurance companies could return to retroactively canceling coverage for a sick patient based on unintentional mistake in their paperwork. That can't happen anymore. 6.1 million seniors saved over $5.7 billion for prescription drugs. In 2012, more than 3.5 million seniors and people with disabilities who reached the Medicare Part D coverage gap received more than $2.5 billion in discounts, averaging about $706 per beneficiary. Since the law was enacted, 6.1 million seniors saved over $5.7 billion for prescription drugs. Also, there's been electronic records reform. According to the Center for Disease Control and Prevention, National Center for Health Statistics, the percentage of doctors adopting electronic health records increased from 48% in 2009 to 72% in 2012. Furthermore, at least 2/3 of physicians have computerized capability to improve patient safety through various electronic tools, like your medications and so forth. You're out of town, you get an illness, and you don't know what you're allergic to, and you have to go for treatment. The doctor will be able to access your records right online. So that's a real nice benefit as a result of the ACA. Okay, how does it impact your particular business? Well, it's going to depend on the size of your business and the number of employees that you have. I'll be discussing this evening businesses that employ 24 or fewer, up to 50, and over 50. And I'm talking about full-time employees, full-time equivalent employees. And the reason the size of your business is important, it's going to determine whether or not you qualify for the small business healthcare tax credits that are out there. A tax credit is a dollar for dollar reduction in your taxes, not a deduction, it's a pure credit, dollar for dollar. Businesses with 24 or fewer full-time employees. If these smaller businesses provide coverage, they may qualify for the small business healthcare tax credit to help offset costs. In order to qualify, a business that employs 24 or fewer employees must have an average annual wage below $50,000 and contribute a uniform 50% or more toward employees' self-only premium costs. The maximum tax credit is available to employers with 10 or fewer full-time employees where an average annual wage is less than $25,000. So the smaller the business and the lower the wages, the better the tax credit is going to be. In 2010 through 13, up to 35% of a for-profit employer's premium contribution, 25% for tax-exempt employers, are eligible to take that credit. Employer may still deduct the remainder of the contribution. If you qualify for the credit, you can also deduct the remainder of the premium cost. And the credits can be claimed through the end of last year. For 14 and beyond, the credit goes up to 50%, 35% for tax-exempt employers. To take advantage of the credit, employees of businesses must enroll in coverage offered by the employer through one of the SHOP certified plans. The credit can be claimed for any 2 consecutive taxable years, beginning in 14 or beginning in a later year through the SHOP. You have to buy your insurance through the SHOP to be eligible for the tax credit. There is transition relief for employers with plan years differing from their taxable years. When I speak of credit, I'm talking about a federal tax credit. Some states may also have additional tax credits available. I'm not certain what Ohio has. I do know that Ohio does participate in the federal exchange, though. There is no state plan in Ohio, but they do participate in the federal SHOP program. So in summation, again, on the business healthcare tax credit, businesses employ 24 or fewer full-time equivalent employees. Plus, the employees' average annual wages are less than $50,000. Plus, the business pays a uniform amount of at least 50% of the employee's self-only premium costs. If you're in that category and you meet all three of those criteria, then you're eligible to take up to a 35% federal tax credit in 13 and 50% in 14 if you're a for-profit entity. Again, it's only for shop participants. You must buy the insurance through the shop to be able to qualify for the health care tax credit. Yes?
You talked about shop. What is shop?
I'll be getting into that. Businesses with up to 50 full-time employees. Starting in January of this year, if a small business of this size chooses to offer coverage, there is a new way to do so through the Small Business Health Options Program, SHOP, Marketplace. There you go, your question answered. There are enhanced small business health care tax credits available for eligible employers with 24 or fewer employees participating in the SHOP. None for over 24, though. All right, the SHOP Marketplace. This began in 2014. It's open here in Ohio. I believe right now there's one participating plan in the state of Ohio, but there's more scheduled to come in a few short months. In 15, I think there'll be 7 to 8 from what I've heard, plans available for small businesses to choose a health plan for their employees. The Small Business Health Options Program, or SHOP, is part of the health insurance marketplace created by the Affordable Care Act. Other employers, it offers employers a choice of health insurance plans and dental plans and tools for making informed choices. The SHOP offers qualified small employers access to the enhanced small business health care tax credit, which is now worth up to 35% of a tax-exempt employer's premium contribution and 50% if you're a for-profit business. The SHOP works with new insurance reforms to spur competition based upon price and quality. If you have fewer than 50 full-time employees, you're not required to offer health insurance, and there's no penalty if you choose not to do so. This is for smaller type businesses who want to provide their employees with health insurance for esprit de corps purposes and to retain them and to attract qualified employees to work at your business. That's why a lot of companies are looking into it, even though if they have fewer than 50 employees, they're not by law required to offer any insurance whatsoever. Small employers who have 50 or fewer employers in 2014 can purchase insurance through the SHOP. You must have at least one common law employee to qualify to purchase insurance under the SHOP. You must offer coverage to all of their full-time employees. In the federally facilitated SHOP, which Ohio means Ohio, this means employees working on average 30 or more hours per week to be considered full-time, 30 or more hours per week. Your business can be for a profit or tax exempt and still qualify for SHOP. And you must meet minimum participation rates. In many states using federally facilitated SHOP marketplaces like Ohio, at least 70% of full-time employees must accept your offer of insurance. And they have a SHOP calculator you can visit if you so choose to assist you with that calculation. Okay, if you're self-employed, single owner, just you. The options for the self-employed, you use health insurance marketplaces for individuals or families. Sole proprietors and shareholders with greater than 2% in an S Corp with no employees would use the marketplace for individuals and families, or owners, co-owners, and their spouses also would use the individual marketplace. Some important features of the individual marketplace: premium assistance may be available depending upon your income level if you're a sole proprietor. Individuals generally must enroll during the open enrollment period, which is coming up here shortly, November 15th of 14, running through February 15th of 15. Special enrollment periods for those with qualifying life events and other limited circumstances might apply, such as marriage or having a baby. Okay, how do you go about using the shop to qualify for the tax credit in 14? Again, you can go to that website there and find out how much the tax credit might be worth for your firm. healthcare.gov/small business credit-calculator. To qualify for the tax credit in 14, employers must have employees enrolled in a shop qualified health plan, meet other requirements for the credit, and receive an eligibility determination from the shop marketplace. An eligibility determination from the federally facilitated shop, which is what Ohio is, means the shop marketplace finds that you meet the requirements to use the shop. You are not required, this is not required, you do not have to get an eligibility determination before buying shop coverage. You can go ahead and buy it right now and down the road get the certification that you meet the eligibility for it down the road. What is required to claim the small business health care tax credit, though, you must get the determination before the end of 2014. And you should send your application within a week of enrollment and by no later than December 1st. So that's coming up pretty quick here, about 2.5 months away. If you haven't acted upon this yet, you should get going on that if you want to claim the tax credit for 2014. In the event you're found not to be eligible after buying shop coverage, you can't claim the tax credit, but your insurance company need not end your coverage. You can still keep the insurance coverage that you bought under the shop. You just won't get the tax credit for it. How do you go about buying shop coverage? Get started now, or offer any time during the year. Unlike Marketplace for individuals, no limited enrollment period for the shop. Okay, there's no limited open enrollment period. You can get started right now and do it anytime throughout the year. How do you buy a shop qualified health plan? For a federally facilitated shop in 2014 only, you must use direct enrollment. And this is what Ohio is. Ohio is a federally facilitated shop. In 14, you have to use direct enrollment, which means you can work directly with an agent, broker, or insurance company. This is similar to how small employers have gotten coverage in the past. Or you can use the same process for buying, a shop qualified dental plan. With direct enrollment, you'll select a shop qualified health plan to offer employees and a shop qualified dental plan if you so choose. You'll submit a hard copy employer application to the federally facilitated shop. You'll have the agent, broker, or insurer help enroll those employees who accept your offer. Remember, 70% of your employees must accept the offer to be able to qualify for the shop and get the tax credit. Or you can pay the insurance company directly or with the help of an agent or a broker. For a federally facilitated shop eligibility to apply, and this is Ohio, ask an agent, broker, or insurance company for help. Or get help from a Marketplace approved navigator or assister. Get the paper application instructions from healthcare.gov, or you can apply by phone at the number you see listed there. Once you apply, the shop Marketplace will notify you by phone and email. By regular mail also, if you request this, within 3 to 5 days of receipt in terms of whether you qualify. The role of the shop Marketplace to determine whether you're eligible to participate in the shop. This determination is a requirement for receiving the tax credit. as I stated before. It does not determine whether you're eligible to receive the tax credit. That's an IRS matter. All SHOP does is say you're eligible to participate in the SHOP, okay, which is a prerequisite to being able to claim the tax credit. But in fact, IRS will decide whether you get the tax credit or not. Okay, a key goal of the SHOP is to offer options for small employers and their employees, such as offering employees a single plan or a choice of plans. Employee choice has generally only been available to large employers. In 2014, the federally facilitated SHOP marketplace offers employee choice, but no employee choice option. You as the employer will have a choice, but there's no employee choice option in 14. In 15, 14 states using the federal SHOP marketplace will offer an employee choice option program available for the employees in 15, just about 3.5 months away. You can sign up for SHOP email updates at that web address you see stated there. And they will provide you with any notifications or any changes in the programs via email if you request so at that website. Okay, here's some of the politicalization of the program with respect to the costs involved. Okay, there's a lot of confusion out there and a lot of misinformation, disinformation, and so forth. So let's cover the employer shared responsibility for employee health care coverage, which begins in 2015. And what I'm going to talk about applies to businesses with 50 or more full-time equivalent employees. Those are employees who work on the average 30 hours a week. In 15, they've introduced a transition relief period for businesses with 50 to 99 full-time employees, including full-time equivalents, and for businesses with 100 or more full-time employees, including full-time equivalent employees. I just want to start, I don't have the slide in there, somehow it's missing from the PowerPoint, but I want you to remember that nearly all 4 small firms are exempt from employer shared responsibility. And what I mean by that is the Affordable Care Act exempts all firms that have fewer than 50 full-time employees, including full-time equivalent employees, which is nearly 96% of all firms in the United States, or 5.8 million out of 6 million total firms. If you have less than 50 full-time equivalent employees, you have no shared responsibility requirements under the Affordable Care Act. Employees or firms that employ less than 50 employees are about, they employ 5.8 million firms, employ nearly 34 million workers, and they are not covered by the employer shared responsibility requirements. However, many firms that do not currently offer coverage will be better able to do so because of lower costs and wider choices in the SHOP marketplaces. Sorry about that. Okay, we talked about what is a full-time employee for shared responsibility, 30 or more hours per week. That's a full-time equivalent employee. To calculate whether or not you're covered under the employee share responsibilities, though, you have to aggregate together part-time employees. For instance, if you have 2 employees working 15 hours a week each, they're added together to equal 1 full-time equivalent employee. Also, if you are a business that has interest in other businesses or common owners, we call that a control group employer. And for employers with common owners or who are otherwise related or aggregated together to determine whether they meet the threshold number of 50, that's 100 for 2015, or more full-time employees, including full-time equivalent employees. If the employer meets 50 or 100 for 2015 full-time equivalent threshold, 2 scenarios for potential shared responsibility come into play. Either an employer does not offer coverage to at least 95% of its full-time employees and their dependents, or the coverage offered to the employer's full-time employees is not affordable or does not provide minimum value. And at least 1 full-time employee receives a premium tax credit in the individual marketplace. For 2015, they have a transition period. They replace that 95% with 70% for 2015. But after 2015, that will go to 95%. If you do not offer coverage to at least 95%, that'll take place in 16, but it's 70% for 15. Let's just talk about an example of this. Minimum value. Coverage provides minimum value when a plan must cover, on average, at least 60% of the plan's total cost of incurred benefits. The Health and Human Services and IRS have an online calculator to help employers input their plan details to determine if they meet the 60% value threshold. Also, the coverage must be affordable. The coverage is unaffordable if the full-time employee's share of the lowest cost self-only coverage that provides minimum value costs more than 9.5% of his or her household income. There is an affordability safe harbor on that because of privacy concerns, and that is if the cost to the employee of a self-only plan is not more than 5% of his individual wages as reported on Box 1 of the W-2, is deemed affordable for purposes of shared responsibility. In the first example there, household income, that would have required the employee to submit tax returns and other members of the family who were not employed with the employer, and that would have been a violation of privacy. So they have a safe harbor on that, and they deal only with the employee's W-2 income. Okay, 2 different scenarios under shared responsibility. If coverage is not offered to at least 95%, 70% in 15 of full-time employees and dependents, then the payment applies if any full-time employee receives a premium tax credit for coverage purchased in the individual marketplace. The payment owed would be $2,000 a year times the number of full-time employees minus 30 and minus 80 and 15. The payment calculated separately for each month for which coverage is not offered, or at $166.67 a month. The payment will be based on the employer's number of full-time employees for that month. Scenario 2, if coverage is offered to full-time employees but either not affordable or does not meet minimum value, then the payment owed to be $3,000 a year per full-time employee who receives a premium tax credit for coverage purchased in the individual marketplace. The payment in this case would be calculated at $250 a month, and this payment can't exceed the payment described in scenario number 1 in the left-hand column. So even though it's a higher cost here on the this example, you're not going to pay any more than you would under example number 1. Yes, sir.
How does the employer know if the employee gets premium credit?
if he gets insurance in the marketplace? On his own, you talking about?
Yeah, it says if at least one employee gets insurance when he gets the credit. How is the employer going to find that?
I think you'd probably have to ask the employees if they've obtained any coverage elsewhere. I think it'd be incumbent upon the employer to find that out.
I don't know about it. I say it's not your business.
Well, I mean, all you can do is your best to do that. You probably have to get some guidance from the ACA officials on that. I don't really have a good answer for that. Okay, some other key points under the employee share responsibility provisions. No employer payment is owed for part-time employees, even if they receive a premium tax credit. Okay? If employer offers affordable coverage that provides a minimum value to a full-time employee who declines it, there's no employer payment owed for that employee. No payment is owed if an employee obtains coverage through means other than the individual marketplace, such as the spouse's family coverage. To avoid an employer payment, employers that offer coverage to full-time employees must also offer coverage to the dependents of those full-time employees who are children under age 26. You do not, however, have to offer coverage for a spouse. There is a transition relief for dependent coverage for 2015. You don't have to offer it to dependents in 15, but that will kick in 16. Employer share responsibility transition relief in 15. For businesses that have 100 or more full-time employees, including full-time equivalent employees, you must offer coverage to 70% instead of the 95% of its full-time employees and their dependents to avoid the employer shared responsibility payment. For those businesses with 50 to 99 employees, full-time employees, including full-time equivalent employees, you're not subject to the employer shared responsibility rules. You do have to, however, offer certification. The certification requirement, you must maintain full-time employees, including full-time equivalent employees, through the year between 50 and 99. Secondly, you can't reduce your number of employees or employees' hours in order to qualify for the transition relief. Employer maintain previously offered health coverage to its employees. Those are the certification requirements to qualify for the transition relief in 15. You can't go back and do something to try and qualify when you haven't been doing it all along within the guidelines that I just discussed. The ACA offers strong incentives for employers to continue to offer coverage. The cost of providing coverage is tax deductible by the employer. By contrast, employer shared responsibility payments are non-deductible. So if you choose not to provide health insurance and you get stuck with the shared responsibility payments, you're not going to be able to deduct those on your taxes. So it's a lot better from a tax standpoint to offer coverage to your employees through the shop and take the tax deduction. Employers that offer coverage have greater flexibility to tailor the coverage to provide those benefits most valued by their workforce, and you'll also enjoy competitive advantage in recruiting and retaining employees. Self-employed business owners and health insurance coverage. As of January of this year, the individual shared responsibility provisions call for each individual to have minimum essential health coverage for each month, qualify for an exemption, or make a payment when filing his or her federal income tax return. So again, you must have minimum essential health coverage for each month, or qualify for an exemption, or make a payment when filing your federal income tax return for failure to have minimum health coverage. What is the minimum health coverage which they're talking about? It includes employer-sponsored coverage, COBRA, retiree coverage, employer coverage through a spouse, coverage purchased in the individual market, Medicare, Medicaid, children's health care, veterans health care, TRICARE, and others is identified by the Department of Health and Human Services. Sole proprietors, those business owners without a common law employee, though not eligible for SHOP, may purchase coverage through the new individual health insurance marketplace. Note, in 2014, enrollment in the individual marketplace is now closed. You can still get 14 coverage in special cases, including marriage, birth, adoption, or loss of coverage. The advantage, again, individuals may qualify, sole proprietors, the advantage to purchase it in the marketplace, individuals may qualify for individual premium tax credits and or cost sharing reductions when you purchase your coverage through the marketplace. So if you haven't done it in 14, it's too late to do it, but you might want to consider doing it in 15 because, again, you can take advantage of the credits or cost sharing reductions if they apply to your particular circumstance if you're a sole proprietor. Okay, some other Affordable Care Act provisions impacting small businesses. Summary of benefits and coverage disclosure rules. That is, employers are required by the Affordable Care Act to provide employees with a standard summary of benefits and coverage form explaining what their plan covers and what it costs. The purpose of the summary of benefits and coverage form is to help employees better understand and evaluate their health insurance options. Penalties may be imposed for non-compliance. The Department of Labor has a sample kit for the summary of benefits coverage that employers may reference. If you go to the Department of Labor website, I'll be providing that address on the last slide. W-2 reporting of annual health care costs, unless required to file fewer than 250 W-2s in the prior year. As of January 13, most employers must report the aggregate annual cost of employer-provided coverage for each employee on the Form W-2. The W-2 reporting requirement is informational only, and it does not require taxation on any health plan coverage. Reporting is required for most employer-sponsored health coverage. This would include group medical coverage. There is, however, a small employer exception. Until further guidance is issued, the W-2 reporting requirement does not apply to employers required to file fewer than 250 W-2s in the prior calendar year. To learn more about the requirements as well as the exclusions, you can go to irs.gov/ACA, Affordable Care Act. Another provision impacting small businesses is the annual tax deductible cap for employee contributions to flexible spending accounts is $2,500. They capped that at $2,500 under the ACA. Employee cannot claim more than $2,500 in a flexible spending account. Also, employers covered by the Fair Labor Standards Act must have notified employees about the new health insurance marketplace by October of 13. So if you're an FLSA employer, hopefully you've done that. If you haven't, you probably should look to see what can be done about getting that notification out, or you're going to face a penalty if you don't. Some other ACA provisions, starting in 14, plans can't impose waiting periods of more than 90 days for otherwise eligible new hires to begin coverage. 90-day maximum wait time. Starting at 14, employers may use additional incentives or rewards under workplace wellness programs, where you can maximize the reward and the increases to as much as 50% for smoking cessation programs. The new health care insurance coverage reporting requirements. Beginning in 2015, the ACA requires that employers with 50 or more full-time or full-time equivalent employees submit informational reports to the IRS regarding the health coverage they offer to their full-time employees. This is known as a Section 6056 rule. New information reporting by issuers, self-insuring employers, and other parties that provide health coverage also takes effect in 2015. These are known as Section 6055 rules. The first of these reports must be filed in 2016. In July 2014, the IRS issued an early release of draft forms of the 6056 and 6055 rules for informational purposes only. The IRS is expected to release instructions and further guidance in the near future on the reporting requirements beginning in 2016. Finally, here's some useful websites you might want to consult for further information on what I talked about this evening. They have businessusa.gov. The SBA is a healthcare website, sba.gov/healthcare. Healthcare.gov has their own website, and the IRS has information on the Affordable Care Act right at their website /ACA. So that concludes my presentation this evening. Be happy to answer any questions you may have. It's a lot of information. It was hard to deliver. I can't imagine how hard it is to listen to it. So.
What is the purpose of the W-2 reporting, if it's just informational?
I think they want to see if it meets the minimum value offered that you must meet if you're required to offer health insurance. Are you meeting the minimum value? I would think it was 9.5% of the gross wages of that employee. Yeah, I think that's just a quick look see for them to see that you're complying with that. I think the big thing out there is everybody hears about the tax credits. The tax credits are only going to apply if you are under 24 employees in your firm and you're paying wages anywhere below $25,000 or up to $50,000. That's where the health care tax credit benefit will come into play. The other things out there about the Health Care Act, you're going to be penalized and pay big fines because you're not offering health insurance. 96% of the small businesses don't have to offer health insurance. If you have 50 or less employees, not required to offer it. If you do offer it, now you have a way of doing it through the shop at a lower cost than you've been paying in the past, okay? But you're not required to offer it. The larger firms of 50 and over, with the transition of 100 or over for 15, that's where the penalty provisions come into play. But that's only 4% of the businesses in the country. Very few firms are going to be affected by that. But I mean, overall, the theory is to bring as many people under, the principle of insurance is to bring people under the umbrella to reduce the pool of the risks and lower the cost. That's what the Affordable Care Act attempts to do. And it gives an opportunity for an employer who in the past couldn't afford to provide health insurance to his employees. You now at least have an ability to take a look at doing that if you want to. If you're under 50, you're not required to, but if you want to offer health insurance because you want to, you appreciate your employees and you want to give them some good benefits, or, you just, for competitive purposes, you want to attract and retain good employees, you're now able to consider doing that with the Affordable Care Act. Yes, sir.
If your employer has been for years offering health insurance to something like a clothing line, can they just continue to do that?
You can continue doing what you're doing. Under 50? Yeah, whatever you're doing now, you can continue doing it. But the only thing is, if your average wages are $50,000 or below, you're not going to get the tax credit if you do that because you're not buying the policy insurance through the shop. You have to buy it through the shop and be certified as shop eligible to be able to get the tax credit. So I don't know what your particular situation is, but that's something you have to weigh and balance. If you're happy with what you have and the credits aren't important to you, you're free to keep what you have because you're not required to offer it at all if you're under 50. I don't think it's perfect. I think there's bugs to be worked out, but I think overall, some of the things I've seen, the cost curve is coming down. It's been going up for many, many years, the rate of increase, and it's still going to go up, but it's not going to go up as great as it has in the past. So, yes.
If you're an individual in the open enrollment, you said it's from November 15th to February 15th, or no?
For a sole proprietor, yes.
For sole proprietor.
Right.
And you wanted to buy health insurance. Where would you go first to look for health insurance? Would you go to the shop or?
You don't qualify. You're a sole owner, single employee, nobody else, just you, right?
Yeah.
You're not eligible for the shop. Remember I talked about how a sole proprietor, you can't get the shop, but you can go to the marketplaces.
You have to go through.
You have to go through the marketplaces like everybody else, but
Would you
by,
get a discount though?
depending upon your circumstances, you might get tax credits and or premium assistance, depending upon what your income is.
When you say premium assistance, are you saying premium assistance from the government, or where is this premium?
I believe it's offered through the feds. They offer premium assistance, or they contribute.
That premium assistance?
I think you're going to qualify based upon your income when you go in there. You're going to put your demographics into the site when you go through the marketplace to apply for it, and they'll probably determine, depending upon what you put in there, what you're eligible for based upon the input of the data that you put in there. It's all income based.
Whether you want to go with whatever company.
Right, that's correct. You'll see the companies on there. I think next year it's going to expand. I think at least there's one for sure, and maybe more this year, but in a couple of months there'll be more in 15. I know that for a fact. So, any other questions? Yes.
So if you're one employee in an S corporation, you can use the shop?
No, you cannot use the shop. Shop, you must have at least one common law employee other than yourself.
What's a common law employee?
An employee beside you. If you go to your books,
I mean, like if my dad's president of the corporation and I work for him, am I in?
he's the owner, 100% owner of the corporation,
Yeah,
and you're an employee.
yeah, then I would.
And
qualify.
he does he have his own insurance, or would he be interested?
Yeah, he would be. I just have to find out.
I think you're going to have to consult your legal or tax advisor. I don't want to get in and answer individual questions because I'm really not allowed to do that. Mine's a general overview. I think specific, you have to talk to your
I didn't
CPA
know
or
what
your,
common law employee was,
yeah,
so.
that's you. So, any other questions? So, yes, sir.
The control group, you mentioned control group.
Yes. Affiliation.
Affiliations, is that the same group of rules they use for consolidating tax returns?
Again, you're asking a tax question that I'm not able to really answer. I think you have to ask your.
How do you determine what's a control group?
A control group, I know for our purposes of common ownership. If you own a company,
Any percentage?
possibly, it could be an affiliation. I know for our loan programs, for determining size, to make sure you're a small business, we look at affiliation. And affiliation is defined if you're the owner of a business and you have ownership interest in other businesses, we're required to factor in the size of the other business into the equation to see if you are a small business for purposes of applying for the loan, with the company you're applying the loan for. It could knock you out of the ballpark toward being considered as a small business. And that does happen sometimes if people have common ownership interests. Any other questions? Anybody looking for a loan? Cover that tonight too if you want. Give you a 2-for-1, you know, so. What kind of business are you in? Consulting, okay. Healthcare consulting? Your bookstore, and you?
I'm a self-employed CPA.
Oh, are you? Okay. Yes, sir.
Little gym business, kids gymnastics.
Okay. Sir? CPA? No.
CPA,
CPA.
have an income tax practice. Small business owner.
Can't hear you.
Consulting.
Yes? Same. Yeah. Yes.
Two scenarios. I have a client who has employees who are all covered by their spouse's insurance.
Okay.
And I have another employee that is, well, another client has employees that nobody has insurance.
How many total employees in the company? 40? 4. You're not required to offer health insurance. You're under 50. You're not required to offer health insurance. If you choose to do so, you can do whatever you want because you have no requirement to offer it.
But if he did, I mean, you can get the credit, right?
You what?
If he did offer it.
If you did offer it, then you can go through the shop and maybe get tax credits and premium assistance if you're applicable. So, okay, if that's it, I appreciate your attendance this evening and thank you for coming.